Good morning. Before you decide to undergo hair transplant surgery, you have to make sure that you have consulted with your physician. This is a very important step because here, you will get to know your physician and he will get to know you. Rapport will be established and goals for the procedure clarified so that both parties will have a pleasant hair transplant experience. Hello everyone and welcome to Hair Transplant PH vlog number 4 and welcome to our clinic. And before I forget, if you, a family member or a friend is suffering from any hair loss problem or if you just have great interest in this topic, just click and like the subscribe button below. Hey everyone, good morning Dr. Jean. So ano bang pag-uusapan natin ngayon?
Okay, so today we will be talking about the consultation for a hair transplant procedure. So this is a very important step because the doctor and the patient will be able to set a goal for his transplant surgery.
So tama yun, no? So actually, this is one step na ayokong i-rush. Bakit kamo? Kasi the patient should understand the entire procedure and kung ano yung pinapasok niya. He has to understand what will happen before, during, and after the surgery.
So, paano yung process for consultation?
Okay, so consultation now can be done face-to-face, pwede pa rin, or with the advent of technology, pwede na rin online consultation. Okay, so ano ba ang nangyayari sa isang consultation process?
Okay, so first, we need to collect the general and medical data. So we will let the patient fill out this form. So we will get your name, your age, and the history of your balding process. So kailangan nyo ikwento sa amin kung paano naging bald kayo. We need to also know your family history. So this is very important. So sino ba sa family ang nakakalbo? Either mother side, father side. So we will also ask your medical condition. Do you have any other illnesses, mga sakit? Meron ba kayong maintenance medication? Meron ba kayong surgeries from the past? And especially allergies to any medications. So we also need to ask your personal and social history. So if you have any tattoos, if you have drinking history, or are you a chronic smoker? So all of these information should be asked.
Ang dami naman palang tinatanong. Para saan ba lahat yan?
Siyempre, all these data are needed so that we can figure out our surgical approach and to maintain your hair in the long run.
Ganun pala. Okay, so next, we will do naman a physical examination of the scalp. Kasi we have to assess the scalp, its condition, yung degree of baldness, at saka yung availability ng donor area. Pagkatapos naman ng physical exam, we will talk about the patient's goal. Ano bang gusto ng pasyente? Gusto ba niya ng lowering ng hairline? Gusto ba niya magdagdag ng density or kapalan some areas of the scalp? Or gusto ba niya maglagay ng coverage in some bald areas? And hanggang saan niya gusto ito? So pagkatapos nun, we have to agree on the patient's hairline design. So ano bang gusto niya? Much like designing clothes, we also design hairlines, no? Ano bang gusto nila? Round shape, square shape, heart shape, may widow's peak. So maraming klase ng hairline design. And it all depends kung anong babagay dun sa face ng pasyente, of course. Then based on the design, we can then calculate for the number of grafts required for the hair transplant procedure. Then kung alam mo na yung number of grafts, the clinic can now give you an estimate on how much will be the total cost. A hair transplant technique will now be chosen whichever suits the patient's best. Would it be the strip technique or the FUE technique? Ang isa pa palang important na pinag-uusapan is, mag-shave ba tayo ng hair mo or hindi?
So at this point, we need to now discuss the step-by-step technique of the procedure. So first, we will be discussing with the patient the anesthesia to be used. Next, the harvesting procedure wherein the hairs from the back will be taken out And then, next would be the procedure on how it will be placed back on the recipient area. Pag-uusapan din natin yung pwedeng mangyari after the hair transplant procedure and especially your follow-up.
So, few more things. You will also be requested a few laboratory exams that you need to submit to the clinic. Finally, the choice of surgery day is agreed upon and we can proceed with your hair transplant procedure. So, yun yung mga pinag-uusapan natin to ensure that the patient and the doctor will have a smooth flowing hair transplant experience.
So for our next vlog, this is very exciting because we will invite you to take a peek on what happens in a hair transplant day.
So, see you then!
See you!